Hello everybody and welcome to UroChannel. It is 2022 and I just came to realize that it has been 5 years since I opened my office in the village that always sleeps. Well, maybe not at 2 a.m. on Saturday nights at the bus stop. Hey you, shut up! But anyway, it's been 5 years since I bought my low-intensity shockwave machine, also called ESWT. So time to give you an overview of my experience, the ups and downs of shockwaves in the treatment of erectile dysfunction. My name is Stefan Buntrock, I'm a urologist and sexologist. When it comes to treating erectile dysfunction with low-intensity shockwave therapy, there is one mode of action that is missed in the scientific discussion that I figured out by experience working with ESWT on a daily basis. Patients with a special feature will see huge results within a few weeks. I will tell you about it in a minute what this is, but before that, let's sum up what is known so far about the action of shockwaves in erectile dysfunction. Shockwaves are acoustic waves that cause microtrauma to the cells within fractions of a second. At first, there is a burst of pressure followed by traction. All this happens in milliseconds. This shear stress activates repair mechanisms within the cell. Preclinical studies show effects in blood vessels, the corpora cavernosa, interstitial tissue, and nerves. In short, the good stuff gets upregulated. Shockwaves act like rejuvenation on the cells, so there will be more nitric oxide, more smooth muscle, less collagen, and so on. In clinical studies, these effects can be measured by looking at the peak velocity of the incoming blood into the corpora of the penis. Examination by Doppler ultrasound showed an increase of 5.8 centimeters per second compared to baseline at 3 months after 12 sessions with ESWT. This is a lot. The threshold for normal systolic velocity is around 35 centimeters per second. However, we don't know whether all shockwaves are equal. The majority of studies have been performed with the electrohydraulic Medispec ED1000 and the electromagnetic Dornier Aries 2, which is the one I am using. To this point, it is unknown whether other modes of shockwave generation will have the same effect. There are differences in focus and energy delivery between the machines. There are also differences in treatment protocols in terms of the energy delivered in total, per treatment, and the number of treatment sessions in total and per week. That makes scientific results difficult to interpret. So far, better results have been obtained with more frequent sessions per week and a higher energy flux density. Shockwave machines are medical devices that are only sold to medical units. In the comments, some of you have asked about the machines from China they sell on Amazon. They are of little, probably no use at all, and cannot be compared to the kind of device I'm talking about here. The question that is of most interest is this: who is suitable for the therapy and who is most likely to benefit? It has been shown that those who respond well to the PD-5 inhibitors Viagra and Cialis also do well in ESWT. According to research, the effects to be observed after 18 sessions almost equal that of PD-5 inhibitors. Usually, it takes time until results can be observed. The body has to react, and it may take 3 months for noticeable increases in erectile function. In the beginning of the video, I promised you to reveal that one thing I found through clinical experience. If there are pelvic floor issues with pelvic floor overactivity, effects will be seen much quicker. Already after 2 weeks, erections will start to ameliorate. This has to do with the role of the pelvic floor for erectile function. In pelvic floor overactivity, certain key muscles may be shortened, resulting in a decreased rigidity with erections. Shockwaves are able to restore muscular function with the result of better erections. So far, this feature seems to have been overlooked in clinical science. I always combine shockwaves with simultaneous treatment with PD-5 inhibitors. Recent scientific publications show that there is an enhanced overall effect with this combination. During the years, I tried to figure out predictors who would be likely to respond to treatment and who won't. because not all patients get results. So far, I still struggle with reliable parameters. It seems, however, that a lack in penile cellular substance is associated with unfavorable outcomes. In other words, if the penis is compressible like fresh sandwich bread, you know what I mean. You buy it this size, and if you squeeze it, it becomes really flat. These men don't seem to do well. But even here, I sometimes see results. Since there are no side effects, I advocate to try 6 sessions and wait a few weeks to see whether therapy might be effective. If you haven't done so, please subscribe to my channel for more urological content to come. Thanks for watching. Bye bye.